We all recognize when we've been in departments that work and don't work. And I think the key in the emergency department is to be able to provide structure in a otherwise chaotic environment. And a lot of that structure, the problem is that adherence to the structure in this 24/7 environment is always the challenge, right? You know, night shift comes on, administrators are not here. How do you make that structure part of actually the culture of the department? And that requires a level of vigilance that we probably are not used to. It requires, you know, there are times when this process went live, I would come in at 1 o'clock in the morning just to see how things are going on, right? And I think for night shift staff, for the staff, the leadership has to be very engaged. The leadership really has to be there, you know, on the front lines. When I've done this before, you know, I would work more clinical hours than any physician just to make sure that I was there and hand-holding through the process implementation. So leadership engagement, you know, cultural, enhancing the culture, the overall workplace culture of the place, the buy-in, all those things are important. Really, the process at this point is actually not as important as these other factors. Really, it's just adherence to the process, the leadership, the culture, all these factors are much more important to driving the success of a department. I've been involved in 11 emergency departments before this, and I've never been in a department like this. One, and I can say this very honestly, that I've never encountered a nursing staff as competent and as strong as this one. It's incredible to see the level of competency that the nursing staff here at Hahnemann University Hospital has. I just haven't encountered that level in an emergency department before. So there's that level of competency. And what's also interesting about this institution is that the commitment to the institution, not just in the emergency department, but across the hospital, is amazing. I've never seen, you know, there are people who have been here, medical school, residency, you know, this is their career work, and they've been here for 20 years. You know, our CMO has been here for 55 years. That is incredible. You know, you don't see that anymore in institutions. So there's something about this institution, this patient population, this hospital that has such a committed staff. And that's something that's, to me, is something that was very unique that I haven't encountered before, which actually, you know, very pleasant to work in such an environment where you have people that it's a challenging place to work. It's a challenging patient population. You know, the department at times can be under-resourced, you know, based off of, you know, historically. But they still, this competent staff still stays. And that to me is incredible. I think it speaks to why the cultural shift why the process improvement was so fast, right? Because I think you had such a strong substrate here that just needed a degree of structure and organization behind it. And I think that's leadership's responsibility to identify that. That when you identify that you have such strong clinicians, strong nurses, empower them. Really empower them. I mean, that was actually, to be honest, if I were to say what is the one thing we did, we empowered our frontline staff. And they came up with a lot of these changes. We implemented it, and you know, we're on the path to success.